Hello, if you are watching, or rather just joining us, welcome on board. We are heading into the Kickstarter this morning. That was, of course, supposed to come a little bit earlier, but no doubt we're glad we are finally here. Emmanuel Ainebyoona, the spokesperson at the Ministry of Health, is joining us alongside Allana Kembabazi, the programs manager for Right to Health Initiative for Social and Economic Rights. Before we go any further, what is Right to Health Initiative for Social and Economic Rights?
Actually, it's the Right Health Program and the Initiative for Social and Economic Rights, and we work holistically on economic social rights, so health, education, business, human rights, issues of the economy. Does it function for people in terms of economic inclusion? Are you financing the social services that matter for people? We have a campaign on public services right now, particularly around strengthening public health care, public education, just the things that everyday Ugandans need. And we do it from a human rights-based approach.
Okay. That's very interesting. No doubt we shall be very glad to hear more about what the initiative is up to. For Mr. Ainebyoona Emmanuel, no need to explain the Ministry of Health. No doubt today we shall be speaking specialized healthcare in the country and how health financing is helping in achieving this particular goal. One of the debates that has refused to leave the public sphere is the expense government spends on sending officials abroad and Ugandans in their capacity to do the same. To speak to us, of course, you're the two who are going to help us understand why, where and what can be changed or improved to ensure that specialized healthcare is brought to the average Ugandan. We come into this conversation on the backdrop of the death of the Right Honourable Speaker of Parliament, Jacob Oulanyah. He was flown out of the country to seek specialized treatment. Others would, for example, reason that some of these facilities that he was taken to access should have been available within the country if funding and perhaps allocation of resources were more optimum, and of course something that deliberately undertaken by the powers that be led by the Ministry of Health. What do you make of the state of specialized healthcare in the country, so much so that we are now under the shadow of our inability to provide it for especially our leaders, before we even come to the fact that Ugandans at the average or grassroots level cannot actually access it?
Thank you very much, and good morning, viewers. I would not say that we lack specialized services. We have specialized services in Uganda. And if I'm to begin with, the Uganda Cancer Institute has been earmarked the Center of Excellence in Oncology Care in the entire East African region. And we have patients that come as far as Ethiopia, DRC, Rwanda, coming to Uganda to seek cancer services. Specialized services are at the tertiary level. We have primary health care services and also the tertiary care, which is specialized services. And we are seeing more and more people because of these lifestyle diseases, also referred to as non-communicable diseases that include cancer, now on the rise, now starts requiring tertiary care. And we have the Heart Institute, which also offers specialized care, heart surgeries, both closed and open. So I can say we have these services, although we are not yet at the level where we want to be as a country. And I'm glad that when they were reading the medical history of the late Speaker, Jacob Oulanyah, they indicated that his cancer was diagnosed at the Cancer Institute. And he received sets of treatment at the Uganda Cancer Institute. His doctor was the executive director, who is a specialist in the specific cancer which he was diagnosed with. So we have capacity as a country, only that we need to make it better to cater for each and every one.
Okay, no doubt you'll be taking us through the efforts that are being undertaken to make that provision of these services better or improved. But let me come to you, Allana Kembabazi. this is a case of social and economic right. Health at bare minimum is supposed to be provided, healthcare services are supposed to be provided to the people. As an organization, you and me can agree that perhaps government is not doing enough to ensure that these kind of services reach the people. Where are we in terms of that advocacy?
First of all, I think the thing we forget in this country is that healthcare is a right.
It is.
When something is a right, it's an entitlement. And when you're not given something, you go for it. And I think it's about time Ugandans woke up. This issue has been happening for a long time. It's not just the late Olanya. And by the late Olanya, we met him in 2019. At the time, he was about to then formally put forth his bid later on. And one of the things he had promised us was he was going to prioritize healthcare. One of the things he said was, why are we flying people abroad for them to be treated by Ugandan doctors, right? And at the time we were talking about cancer care in particular. We had no idea the specifics of, but that is what we were discussing at the time, cancer care and palliative care. And he said, you know, we must prioritize it. And you look at it right from a budgeting perspective to just everything else. How many Ugandans, you know, the president talked about people, why do they die early?
Yeah.
If you have cancer and it's detected early,
the chances of survival are enormous, very high. How
many Ugandans can even get to a point where it's detected early? We're at a point where we don't have regional cancer centers. A whole in 2021. And we saw the effects of this in the lockdown. People who come to Kampala for treatment were stuck here, couldn't go back. Those who could not move were stuck there. The detections were going low. Most Ugandans are detected when they're at the latter ends of this. And if you even go, he's talking about Cancer Institute. I wonder if you have been there and seen. I was there recently in a Feb.
How recently?
And
Feb?
Yeah, Feb this year. Feb, March. I'm not saying Feb. It was recently. It was March. And you will see that the people who have these, what are they called, tundubaris or whatever, they put them at some point there. They put their belongings. The tents and
tarpaulins.
There's a part where they put them. It's not put as a tent, it's just put sort of to cover. They put their belongings, there's like a fence, they put their belongings like this, cover it in case of rain, mattresses and so forth. As in they camp there in the hope that they will see a doctor, in the hope that they will get treatment, because they cannot do the back and forth. If you're trying to get treatment in the public wing, the wait you have to see a doctor, right? Which increases, I mean, that affects, of course, the treatment. It affects, you know, are things detected in time. It affects, so we need to wake up. I mean, the thing that we must realize is the politicians will be okay. They will be okay. They will be okay because they'll fly abroad with taxpayers' money. We spend a lot of money flying politicians abroad.
As an organization, you speak very passionately about the fact that some of these services are not reaching Ugandans as quickly or as sufficiently as they should. Right here is the spokesperson for the Ministry of Health. I would love you to shoot those questions direct to him. What are the issues that you think they're not doing right, especially in regard to these services reaching out as quickly and efficiently as possible?
If you read the Ministry of Health's reports, they diagnose the solution. In fact, I no longer even blame the Ministry of Health because they diagnose the solution. It has to be a whole of government approach. At the end of the day, we have seen that when this government wants to do something, it does it. If it decides it's locking us down and you're being locked down, you're locked down. If it decides it's giving money here, it gives it. Have you heard us shouting about security? What happens? How many years? I want to challenge someone to read these annual health sector performance reports every year. When we come and shout at them, we use their own data. We don't even try to come up. No, we use government's own data. And the lived reality. The thing the Ministry of Health needs to also step up on, of course, would now be the quality issues. Because there are issues with, first of all, not having enough budgetary resources, be able to roll it out the way you need to. Then there's also the quality issues. The issues where you come there and the doctors are absent. You know, that there are a whole host of issues there with quality that they need to begin assessing. But also as a ministry, I think the ministry sometimes has lost its focus. We must remember that healthcare, people will say things like a public good, right? This is the same
social and economic
exactly,
rights.
But also as a public good, and also that the government must be providing it. Over time, what have we seen? And it's not just in cancer care. We have seen over time that the government stepped back, and the private continued to grow and grow and grow. But you can't rely on the private. Someone is there to make money. You cannot rely on them to be the ones who are going to deliver to people equitably access to healthcare. So when you talk about what happened, for example, when they said we are going to bring specialized, when they said we are going to bring Lubowa.
We shall be talking about Lubowa later on in the program. But Mr. Ainebyoona Emmanuel, can you quickly respond to the issues that have been raised by Ms. Allana Kembabazi?
Yes, Allana talks of issues like regional cancer centers, and we are already establishing them in Mbarara. There is already a center. In Omoro is where the Guru Cancer Center is going to be. There is going to be a cancer center in Guru. Interesting symbolism. And already construction is underway. The groundbreaking was done. Already there is one in West Nile, in Arua, and we hope to establish one in Mbari. And also these come with the budgetary allocations. Not that we have failed to identify what needs to be done. All the plans are on paper and are awaiting funding. So it comes with funding. So what we need to be discussing is how quick is the national insurance scheme, for instance, going to be considered to be a major discussion on the floor of Parliament. Do you think the national insurance scheme is it's what's going to fundamentally change? In terms of equity and access, quality health care she's talking about, national health insurance scheme is one of the solutions. Then as we look at also having expanded availability, and these services are free. We have the pediatric surgery hospital currently that offers free surgery to any kind of pediatric condition in Entebbe. And this is free of charge. Specialized surgery for any child in Uganda and accessible for everyone. That is one solution of fixing access to surgery, conjoined twins. You've had success story from Murago National Referral Hospital. All these are happening in Uganda. We hope that the major bulk of the conditions that take Ugandans abroad, like transplants, are also conducted here. That is, if we have the registration. Organ transplant registration passed as quick as possible. In cancer treatment alone, you will respond, don't worry. In cancer treatment alone, there is something Dr. Jackson Orem spoke about, that the new treatments that are being offered, stem cell, therapy, and then gene therapy and stem cell transplant. These are things we would, for example, think Uganda should be able to be providing by now, no doubt about that. You allude to the fact that these are incremental improvements that are being done. Yes, and also that's why the registration, once the registration is passed, it will enable all these sophisticated. We've had that argument to happen. We've had that argument before, not from the Minister of Health alone, but across sectors of government, where officials conveniently say legislation, we are waiting for things like bone marrow transplant. Cancer Institute is ready, has the experts ready to do. You've been at the Cancer Institute. Can the experts there conduct bone marrow transplants and gene therapy?
To be fair, it's not like I went there and interviewed them, can you do it? I think that even if in a perfect world, his legislation passed, and they began doing it, the question is, would people be able to access it? Because if in this, because now, even for the other things, there's some care that is not too, it's something like an injection or whatever. You find people are struggling to access that. The drugs are out of stock. There's time they were stock outs for a bit. The time lag to see a doctor, particularly in the public wing, all of those issues. And I think the Cancer Institute, to be fair, tries to innovate, but there is a real bottleneck that comes there. And I want to respond because he talked about NHIS being a solution. You people, NHIS will only go so far. I am a big proponent of the NHIS, but the NHIS cannot replace a public health. Like you must have a functional public health system.
Which national insurance scheme are we benchmarking, for example, if I may ask? Is it the National Health Service in the UK, or could you take
a public health system? That's not like a national health. You get.
Interesting.
It's their public
in the
health
region,
system.
Rwanda is already doing, Kenya is already doing. So it's us to get also to where to start.
But let's talk a bit about, like, for example, what we've learned from Kenya. When COVID came in Kenya, their version of NHIS was like, so the moment you're detected with COVID, you're done. Now if you have cancer there, you do that mix. Because again, it shows you became like, no, this becomes expensive. Right? And they have had issues. And that is why you must say the first priority must always be to have a functional public health system. But also the ministry was the same one that taken NHIS to government, to parliament, had worked on it for years, then came to remove it. And then that fight, if you remember, where the MPs were like, we shall still pass it. And you ask them where NHIS is right now. Like you've said, a lot of talk for years. In the meantime, people are dying. And it's unacceptable because it's taxpayers' money.
The COVID-19 pandemic exposed a lot of gaps in terms of healthcare infrastructure in the country. We reached a point where we heard stories and even witnessed, especially for the journalists that were covering these stories, where oxygen cylinders were unavailable, where ventilators were unavailable. And then there was talk of the fact that this important and much needed equipment was going to be procured as quickly as it ought to have been procured. Those procurements were never made. Some of them we didn't have specific information availed as to why they weren't. And that continues to expose what you perhaps talk about in terms of when you say we are a center of excellence. For example, Uganda, people come from across the region seeking treatment
for
here.
Cancer Institute.
For Cancer Institute, yes. And I'm sure we should be in a position as a country where people not only come to seek cancer treatment, but it's a bit of a contradiction when people are coming from across the region to seek our cancer treatment, yet Ugandans within our borders are not able to access this treatment.
They're accessing
when they
because
do.
I don't know what you mean.
There are delays.
Because if you see like
giving us an example
what has triggered the debate is that the cancer was diagnosed at Cancer Institute, but there's always a second opinion.
In medical practice,
she talks of rights. You cannot deny anyone
a second opinion.
And a second opinion in an event they are capable of going. So
on their own money, not taxpayers' money.
If the taxpayers' money and their position entitles them to, then it's their right.
But what message does it? It's their right. But what message does it show Ugandans if you don't use taxpayers' money to fund functional public health systems, but then you say it's the right for politicians to fly abroad?
Okay. All right. Now, the debate...
You're trying to divert us, because I'm telling you, the late Honorable Jacob Baranya received treatment at the Uganda Cancer Institute.
Yes.
The doctor treating him was the director. That is, care was available. But there was need for a second opinion. And according to the referrals,
to set the facts,
the referral guidelines,
to set
the referral guidelines
straight.
abroad.
Jacob Olanya was not taken to Seattle for a second opinion. He had already sought a second opinion in Germany.
Yes, and that's
he was
what I'm
taken
saying.
to Seattle to seek stabilization. Stabilization perhaps indicating that Cancer Institute was unable to administer that particular type of treatment.
That is a fact. That is a fact.
Yeah.
Because even according to our referral guidelines, we have referral guidelines in country and referral guidelines for someone to go abroad. And after these guidelines indicate that someone can be flown abroad when that treatment is not available. And this kind of treatment, which was sophisticated, was only available in about 3 centers around the world.
But I don't think this is about
Honorable
Jacob Olanya.
It's not about, it's not, of course it's not.
I think first of all, like I said when I started off,
this kind of treatment
but I wanted to clarify,
is only available in a few centers.
I think we missed the point.
If you heard very well.
I think we missed the point.
And you can.
What point do we miss?
You see, Honorable Jacob Olanya was the latest. There have been so many. And like I said to you at the beginning of my conversation with you today, I said this man, one of the things he had challenged us to do as advocates, he had said, why do we allow a status quo where people are flown abroad, which by Ugandan doctors, what is not happening here. So you are not the one who are targeting. The issue, people are protesting and so forth, is the reality. What is the reality? The reality is we are failing to invest in a functional public health system.
Talking about Ugandans investing in a functional public health system,
and then you
the Lubowa Specialized Hospital is a pipeline dream that Ugandans are waiting for it to come alive. First and foremost, what is the status of Lubowa Specialized Hospital that is under the aegis of the Ministry of Health?
Yes, construction is ongoing, and largely the project developer experienced some challenges, and these were attributed to the prolonged lockdowns during COVID. So the project was affected by COVID and other challenges, of which are being addressed by government, and the deadline time has been extended to 2024. Already there are a number of Ugandan doctors who are in Italy training to offer some of these specialized services we are talking about when the hospital finally opens.
Recently, the investor who is responsible for the much anticipated establishment of Lubowa Specialized Hospital was given another project to conduct before the initial project is done. This trajectory of events doesn't augur well for the realization of some of these dreams, especially improving of health infrastructure. I do not know. Let Madam Allana Kembabazi give us some bit of perspective on that, because we have a way of doing things perhaps in the country where we haven't seen something go on and then we move on to another, and then it seems okay to move on to that aspect.
First of all, on Lubowa, we told government not to do this. Everything about Lubowa was patchwork. You know, when you've messed up. This thing, we have the constitution, first of all, that makes it clear about how some of this is supposed to be done. Laying out the loans before all of that stuff.
Project was illegal.
It was illegal. We're in court, so I will not get into all of the legal arguments, but we're in court about the legality of this project as a whole. ISA is in court about this. But it wasn't just us. Everyone then asked, even aside from the legality, you people, right? And the skipping of all the process that's supposed to do. Was this project going to deliver for Ugandans? Do you remember what they said about Lubowa? This is going to be medical tourism. It will be like rates abroad, but you'll have saved on the flying upkeep.
Okay.
So how many again, I keep saying this to you, you don't have regional cancer centers. You're going to set up a Lubowa Specialized Hospital. And then, remember, the MPs were blocked. Even their own minister at some point was blocked. So what oversight do you think they have? And then when COVID comes, we hear, one of the things he hasn't said, they stated was, it's raining. But the question is, 379 million US dollars for one hospital, when how many Ugandans cannot access basics? But is that the right priority?
Allana,
quickly,
you want Allana wants services like at the hospital in Seattle. They will not come on silver plate.
But let me tell you, no.
Okay, just time for a short break right now. We shall continue the conversation.
Yes, it does, by government.
Allana, we shall continue this conversation pretty shortly.
This is a private
gentlemen and lady, this conversation is going to continue very shortly, and of course we shall delve into why we cannot get the services that the Cancer Alliance Center in Seattle provided, or was supposed to provide, in order to ensure the perhaps survival of some of our people. Time now for a short break, but do stay with us. When we return, the conversation continues. We still have a lot more questions to interrogate in as far as specialized healthcare in the country is concerned, including developments on a children's hospital in Entebbe. We have the spokesperson rather for the Ministry of Health to give us details on that. Welcome back. We're glad you're still with us. If you're just joining us, this is Morning at NTV, and we are discussing specialized healthcare in the country on our Kickstarter conversation this morning. My guests are Emmanuel Ainebyoona, the spokesperson for the Ministry of Health, and Allana Kembabazi, Programs Officer, Manager rather, at the Right to Health Initiative for Social and Economic Rights. As we were going into the break, I spoke about a children's hospital in Entebbe that is part of government's efforts to ensure that specialized healthcare is rolled out to Ugandans. Let the spokesperson from the Ministry of Health give us an update on how far we are, the numbers of children being given pediatric care.
Thank you very much. This children's surgical hospital in Uganda opened in April last year. And I'll get the number of surgeries they have been able to conduct. But what I can confidently state is that it has done a lot of interventions. Services are free. You just need to contact the hospital through their toll-free line, come with your medical records. If it is a surgical condition that is complex, they will be able to attend to you. It's a 72-bed hospital and has about 3 operating theaters and all required equipment. So in terms of children conditions, in the region, that hospital now attracts patients from across Africa, and it's here in Uganda. So it's part of the public-private partnerships we are doing as government to ensure that we avail these specialized health services. We're also venturing in things like telemedicine, where we don't need to fly a patient abroad, but our doctors can consult with doctors abroad to address an issue. We are also heavily training through scholarships where we do not have these specialized skills, such that we send our doctors for neurosurgery, heart care, oncology, and we are making progress. So we hope that, for instance, when the Heart Institute finally sets up home in Nakawa, where they have acquired about 10, where the president gave them 10 acres, they will be able to conduct several more surgeries because we have the skills. The challenge has been space.
Allana Kembabazi, does that information thaw your heart as the Right to Health Initiative for Social and Economic Rights?
Absolutely not. I think we must listen to Ugandans. People, when Honorable Lanya was flown abroad, when the protests started everywhere, people said you're not caring about it. But you have to realize that people are angry. A tree, you know a tree by its fruit. It can say I am in a process of growing, but at the end of the day, for you, if you're a farmer, you want to know, am I having a mango? For those who grow matoke, they'll even tell you, they will look early and they cut. My father do that, he moves them. You're not bearing fruit, you go. There is no point for emotions. So I want us to wake up. I am impatient, and Ugandans are impatient. And this is an issue that concerns all of us. People, these are rights.
Good.
They are entitlements. There are things, they're part of a social contract with a state. The same state that demands you stay at home during lockdown, that demands you pay taxes, is the same state that fails to deliver. So at what point is it enough?
How fast can the country achieve specialized health care if we were to go full throttle?
What I've realized is that this country can do things when they are one-minded. I mean, we started off with 55 ICU. Suddenly it was like, oh, ICU. I mean, look at vaccines. What did we know about COVID vaccination? The next thing, you know, did you see every diplomat you have to go look for vaccines? So if there is political will, and that is what I'm saying, you government, you have failed to have political will. And when you don't, unrest is coming. And I want you to understand that. Unrest will come because people are tired of the inequality. They see politicians flown abroad. Someone wrote an article you saw where they even gave the different experience they have when they are flown abroad. You know, for them as a person trying to get all their costs, fundraising, all of that, people dying when others are flown abroad. Well, get us functional public health system.
No doubt. Many thanks for the insight and perspectives on the specialized healthcare in the country. Allana Kembabazi, Programs Manager at Right to Health Initiative for Social and Economic Rights. And many thanks to you too, Emmanuel Ainebyoona, the spokesperson for the Ministry of Health, for those insights and, of course, information regarding the latest efforts by government to ensure that Ugandans receive specialized health care.